My name is Maria Leona VIKTORIAH Lagrama, and I will be performing Administering of Oxygenation. So, the definition for this procedure: oxygen administration is the delivery of supplemental oxygen to a patient to maintain adequate tissue oxygenation and prevent hypoxia. So the purpose for this procedure is to relieve hypoxia and improve oxygen saturation, to support respiratory function in compromised patients, to prevent complications related to low oxygen levels, to maintain comfort and safety during oxygen therapy. And then the principles for this procedure is that oxygen is a medication and must be administered with a physician's order. Also maintain safety precautions, example, no smoking signs, and also ensure correct flow rate and equipment setup, and then also monitor patient's response and comfort, and lastly, to document accurately and evaluate effectiveness. So, the equipments that will be used in this procedure is firstly the nasal cannula or oxygen mask, so appropriate for the patient size. Then the oxygen source with flow meter and humidifier. Next is the distilled water for humidifier chamber. Then adhesive tape. Next is the pulse oximeter. And then also the no smoking signage. And then documentation sheet. So the first step to do is to check the physician's order and secure needed equipment. So this is to ensure correct therapy and readiness of safe administration. And then place a no smoking sign on the client's door and in the viewing areas. This is to prevent fire hazards due to oxygen's flammability. And then explain the procedure to the client. So this is to promote cooperation and reduce anxiety. So good day, ma'am. My name is Lagrama. I will be your nurse for today. So ang atong buhaton karon is mag-administer tag oxygen sa imo, ma'am, ha. And then we are going to regulate the flow and the client's response. This is to maintain the therapeutic effectiveness and monitor the tolerance. So we are going to choose the appropriate oxygen administration equipment. So select the appropriate size of the mask that best fits the client. So we do this to ensure the proper seal and comfort of effective delivery. So this will be the mask. And then show how the mask is filled with distilled water to the humidifier chamber non-pre-filled oxygen mask. So this is to prevent mucosal dryness and enhance comfort. So now crack the flow gauge and test the flow meter. So this verifies equipment functionally. And then attach the connecting tube from the oxygen mask to the humidifier outlet. So this connects the oxygen source to the delivery device. Going to set the flow meter at the rate prescribed in in liters per minute. So this ensures correct dosage of oxygen. And then check the gauge and mask, prescribe oxygen mask over the client's mouth and nose. Tighten and adjust to cover the client's face. So this is to ensure secure, fit, and effective oxygen delivery. And then check the pulse oximeter for reading and recording. that, monitor the oxygen saturation, and this is to ensure evaluating the therapy effectiveness, and also determine the client's comfort and oxygen use.